One common scenario in a patient with a respiratory illnesses like asthma or even bronchiolitis in small babies, patient come to you in a pediatric emergency and initially they have a normal oxygen saturation. So you give them ventolin, bronchodilator like salbutamol, and after a couple of hours, they are desaturating on room air, like 89. To begin with, they have a 94 saturation on room air, but later on after ventolin, they are desaturating in 88 or 89. So as long as patient is clinically improving and respiratory rate, which are they are tachypneic and now improving, you don't need to worry about much about oxygenation issue in these patients, especially if the X-ray is normal. So what happened in these patients to begin with? Initially, when patient came to you in an emergency and they have an obstructive airway disease, nature do hypoxic vasoconstriction. What happens in these patients? The blood flow is shunted away from obstructive airways so that there will be minimal VQ mismatch. But once what happen in these patients, once you give them, like you can see on the left side, so once you give them ventolin bronchodilator, what happens? Other than opening the airways, you also end up by opening the hypoxic vasoconstriction provided by the nature. And because also there are beta 2 receptors in the vascular endothelium of the alveoli. So ventolin, other than taking action on the smaller airways, also it acts on the vascular endothelium by vasodilatation. So what happens? The lung is not open properly and still there is a atelectasis or collapse, but you have a blood flow going more towards these parts of lungs which are partially closed. So what happens by giving ventolin in these patients? Your VQ mismatch is more because now this is poorly oxygenated blood, because still there is obstruction because of the primary disease. So that's the explanation, because by giving ventolin in these patients, actually hypoxic vasoconstriction, which is protective to decrease the VQ mismatch, you are opening the obstructed vessels. So in these patients, as long as they are clinically improving and their saturation is hanging like 88, 89, and their X-ray is fine, and their tachypnea is better than before, you don't need to worry much about the oxygenation issues. And you can safely wean oxygen in these patients.